Fiber One, good morning to you. We're going to, morning Spencer.
Good morning.
We're going to jump right into a conversation here with a couple of great folks from Mason County, Dave Windom and Dr. Daniel Stein, who is the health officer for Mason County and been on the job now since July after Dr. Hughes' retirement. Good morning to you both.
Good morning.
Thanks for coming on. And Dave, good to see you. And Dr. Stein, nice to meet you. And thanks for coming in. Obviously, a big topic of conversation now is the coronavirus, COVID-19, and some of the ways that you have been talking to the elected officials. I know you've had some informal meetings with them after the council meeting on Tuesday, and you've been meeting with the hospitals and other groups about this. Can you please just give us kind of an update of where we are, maybe even overall, and then we'll scope it into how Mason County is being impacted with this?
So at this point, we are now, this has gone pretty widespread around the world. It started in China and is now spreading through Europe. And we are now seeing several cases in the United States, and specifically in Washington State. And the big recent developments is that we're seeing more person-to-person transmission of the disease. And so we're now looking at changing kind of the prevention of it coming here to now expecting that there is now some transmission, kind of low rate person-to-person in our community and in our state. We are, so right now we still have kind of the same message to take home. This is cold and flu season. The coronavirus, not this novel coronavirus, but the coronavirus in general is one of the common causes of the colds. So we are recommending the routine things that you do for the common cold. So washing hands on a regular basis, not going to work if you've been sick, trying to distance yourself from people who are sick, washing things down on a regular basis that you're touching frequently, washing hands.
We've seen a lot of the reports on kind of the runs at the grocery store for the different things, the Purells and the Cloroxes and the hand sanitizers and things like that. And as we're washing things down or using those types of things and washing hands, what are some of the things that we may have learned in elementary school about washing hands that we've over the years forgot? Is it a certain amount of time, a certain amount of heat to the water, a certain type of soap, or should we just kind of, is there a song that we can sing while we're washing our hands or something like that?
Well, it's, washing your hands with soap, non-antibacterial soap, for at least 10 to 15 seconds before and after you use the bathroom, before you eat. If you sneeze or cough into your hand, make sure you wash your hands. And that's one of the most the biggest public health measures that we recommend to help spread any illness.
Dave, what are some of the things that you guys have been talking to the county commissioners about and the other public officials in the county about how to talk to their staff about this and then getting the information out there?
So we've actually stood up the incident command team. So I'm the incident commander for this particular outbreak, and that gives us the ability to pull in all of our resources and talk to everybody in one location. So we've been briefing the commissioners. We've been working with fire and EMS. We've talked to the hospital folks, gone out and done some coordination there. Last night we talked to the school administrators and answered a lot of questions and put out the same message about personal hygiene. And we're going to continue to work the rest of this week into working into some of the homeless camps and working in towards shelters and places where people are in close contact, and start working to get that message out about personal hygiene.
When it comes to misconceptions out there on social media, that can move very fast, as you guys both know, with people will ask a question or they'll make a statement, and whether or not it's accurate or not, it will be shared very quickly, almost as fast as some of these viruses can be spread out there. What are some of the main things that you're hearing about this that are inaccurate that people should just either stop saying or have at least some sort of information to back up? Whoa, that's not I listen to the health professionals, and here's what they're saying about this.
I've had a couple of interesting ones. I had one call and asked me if she holds her breath for 15 seconds and does that without discomfort, does that mean she's clear? And that's not how that works. So there is a lot of misinformation going around, and our message always comes back to, it's personal hygiene. Keep clean, wash your hands. If you're sick, stay home.
Yeah.
If your kids are sick, keep them home.
And I would say that make sure the information that you're getting is good information. So when people ask me where to look for good information, I direct them to the CDC website, the Washington Department of Health website, and we're also linking several good resources on the County Public Health website as well.
I saw a video from a doctor the other day that was talking about how it gets into your body, into your lungs, and they were saying how it can't necessarily it won't get through your skin. It goes through your mouth or through your nose, and that's where it can get into your lungs and attach there, and that's kind of where there's those runs on the masks. The N95 masks are the ones that health professionals have. If you see a lot of folks with those other masks, you see them maybe over the bridge of their nose, but the sides are open, and that can get air in there just as well with those types of things. Are those effective forms of prevention, or is that something that you'll put on someone just so they don't touch their face all the time?
That's a great point. So we are seeing that people are running out to grab masks and everything like that, and they are not an effective measure to reduce the acquiring this type of infection, this type of respiratory infection. So we know that there are, especially with the commercial type of masks, there are viral particles that can escape through the masks. So protecting yourselves in that measure is not accurate, and people who wear these masks tend to also touch their face more often, and that can be another source of infection. We do recommend that people who are going to the doctor's offices and everything like that wear masks, not necessarily because again, the viruses can still go through the mask, but it reduces, if people are coughing and sneezing, the amount of droplets that are getting on surfaces and potentially infecting others.
One thing I find interesting is, and I think the media frames a lot of this and kind of hypes up concerns over certain illnesses over others, but I'm amazed at how many people don't know that 60 to 80,000 people a year die of the common flu every year in this country alone, not to mention the whole world, and yet there's no run on Purell, there's no people running out of toilet paper, there's no chaos. I remember when swine flu was the thing, and two of my kids had it when they were very young, and we were scared to death over it. They were home 2 days with very high fevers, and they were back to school on the third or fourth day, and they were fine. How much of this is framed, do you think, by the media, and why aren't people scrubbing their hands? I mean, the good thing coming out of this is people are being more hygienic, which is good to see, but why do you think with the flu that kills so many people, so many more people around the world, that you don't see people... Schools don't shut down every flu season, and we don't have all this concern about it? What are the differences?
Well, I think because this is new, and anytime something is new and unknown, we're still studying. There's a lot we don't know about this particular virus, how exactly it spreads. We do know that 80% of those that are infected will have minor or no symptoms. So really, this particular flu concentrates on those who are already immunocompromised. So those are the people we really need to pay attention to. And for everyone else, like you said, this is hygiene. This is flu season. Do the same things you would do with a normal flu season.
You mentioned at the start of this the name coronavirus, and as we learn more, that's kind of the overarching name for the virus. Is this specific one that we're dealing with now, that's COVID-19? Is that right? Or is coronavirus, there's a lot of things underneath there, is that right?
So the novel coronavirus is the virus that causes the disease of COVID-19.
Okay.
COVID-19 is the disease, coronavirus disease 19 because it was discovered in 2019. The first case in China were in December.
Okay.
And just to get to that last question as well, one of the reasons why there is such hype behind this is that it did spread so quickly in China. It is something that is new to the human species, so we don't have this innate immunity. We don't have this protection against it like we do for a certain amount for other viruses. We don't have a vaccination for it yet. That vaccination is being developed, but I wouldn't hold my breath, and I would be expecting that would probably be at least a year out, a year and a half more likely. So I would say that the risk of transmission is high, but the risk to individuals is still pretty low.
Now you guys have to get off to another meeting here shortly, so I thank you for coming in this morning. Dave Windom, Dr. Daniel Stein, the new health officer here in Mason County, and if there's further updates, please share them with us, and anytime the doors are open and welcome. Thank you so much for coming in.
Thank
Thanks
you
for
for
having
having
us.
us.
Thanks so much.